Hello, welcome to DocDano.com. I'm Dr. Dan McCoy. So in this tough economic times, you might have trouble paying your bill. So what happens if you can't pay your doctor bill? Well, today I'm here with Judy Huggins, a business specialist in collections, who's going to talk to us a little bit about what happens if you can't pay your doctor bill. So Judy, here's the deal. I don't have any money and I can't afford to pay my doctor. What happens?
Well, the best thing to do is communicate with the office. If you have insurance, it'll probably be handled one direction, and if you're self-pay, if you're paying out of your own pocket, it'll be a little bit tougher, but you have to just look ahead.
So here's the scenario. I'm sick, okay, and let's say that I have a problem. So what's the first thing I should do if I don't really have insurance and I don't have a lot of money to spend on my health care? What should I do?
Hopefully you've saved a little bit back, and you can call an office manager. Describe your situation, explain for sure that you don't have insurance to back you up. And there should be what we call a cash pay price that's generally, it's a price that's below the contracted amounts generally, but not...
So it's like a discount.
It's a discount.
So it's good to let that office know in advance that you don't have insurance and that you might need to negotiate a rate before you get your care.
Before. And be specific. If there's a procedure that needs to be done, if you know there's something other than just an office check, realize that for each procedure that's done or each drug that's prescribed, that there would be an additional cost.
So it probably wouldn't be unusual if that office required a deposit, maybe? Would that be, I mean, you might know if you know that you're coming in and you don't have insurance, would it be a surprise for an office to request a deposit?
No, generally an office will require payment at the time of service. If you're not able to do that, then you need to say that up front. You can get estimates for just office visits. You need to say if you've been referred by another physician. If you're coming just for a check or a preventative, but you are actually describing a sick visit, those amounts are different depending on the kind of visit that you come in.
Okay, well let's tell you another story. So what happens if I go to the doctor and I see the doctor and I get to the payment window and I just kind of blow right by that payment window? I don't go by checkout.
Not a good situation.
Well, not a good situation. So I just blow out the door, and the doctor's office is probably going to send me a bill, right? I'm going to get a bill in the mail. It's probably going to be for the standard fee, the full amount. Mm-hmm. What happens if I can't pay the bill? What should I do? What would be the next step?
Well, I would call the office manager for sure. Go into the insurance area.
Now, you would call the office manager before as soon as you got the bill, you wouldn't wait till you get collections or...
The best way to handle it is to be upfront. You wouldn't want to blow past the checkout window, and you really wouldn't want to come in without having made arrangements before you come in. If you're hitting it head on, then you're going to have an opportunity to negotiate. You're going to be able to make a plan, and you're going to appear as someone who's going to be honest with your word and with your money. That in that kind of a situation, you might get a payment plan. If you're trying to get in and out the door without working with someone, then negotiations will probably be less.
So most offices, they may not have a payment plan policy, but if you can't pay anything at all, most offices will probably consider at least working with you. And that's what you're saying.
I am.
Okay.
I don't know of
any.
any.
And I guess if you don't, then what's the normal course of events if you don't pay a medical bill? What happens?
Well, of course, you'll get phone calls and letters. You eventually would end up in a collection situation.
So that actually turn that medical bill over to the collection agency?
Yes, and eventually it can go, farther into a legal situation if it's a big debt.
So, maybe it could affect your credit? Could it affect your credit score?
Yes, it can. Well, it can be on your credit report. Medical bills are sometimes handled separately, looked at a little bit differently, but it would be on your report.
Now, you've been doing this a long time, so I guess if you tell an office in advance that you don't have insurance and you're going to have to pay cash, do you think it affects maybe the medical decisions that get made? Maybe the doctor decides to use a generic medicine, say, over a name brand medicine. Maybe you elect a different treatment choice. Do you see that happen all the time?
The advice I normally give is if you're going in and you don't know what's going to be discovered, you've got some questions that you need to ask, You need to say that up front to the provider. Be sure when you walk into their office, their exam room, that you're communicating that with them, because maybe a treatment can be delayed a few weeks. Maybe you can come back, for another visit and have it be extended over a period of time.
Now, last year in America, the number one health insurance product that was sold was the high deductible health plan. Now, that's insurance, right? I mean,
Right.
those patients have insurance, but
Right.
what problems has that created, say, at the desk or at the front window or in the billing
Probably
department?
the biggest misnomer is that people get their explanation of benefits back, or they get an envelope in the mail that says they owe money, and they call and they say, well, this wasn't covered, and you said this was covered. Certainly it was. It was just applied to your deductible. So if you have an insurance plan with a high deductible, generally you have a lower premium. And at that point, you need to be proactive and begin to put money back to cover the high deductible plan.
Now, Dave Ramsey's out there on his radio show, and Dave Ramsey's telling every patient, when you get this bill, you negotiate, right? So is it baloney? I mean, can you negotiate if you
can
have
negotiate
insurance?
if you're a cash patient, but if you have insurance and your provider is contracted with that insurance company, then there's already been a negotiation, a contract made between the provider, your doctor, and between the insurance company. So it would be against contract law for that doctor to extend another negotiation, another adjustment.
So that's a big surprise, because most people think with an insurance plan like a high deductible, you could pay cash or maybe get a cash price, but that's not true.
No, that's against the law.
Really? That's interesting. So high deductible health plans, really, those patients are at a little bit of disadvantage on small charges because they can't negotiate the price other than what the insurance
Right.
company.
The negotiation was actually made at the premium level. If you have a high deductible plan, then you have a lower premium that you're paying on your insurance.
So it sounds like to me the best thing to do is planning. You plan
Right.
in advance.
Right.
You notify the office in advance that you're a cash pay patient. You work with the provider on telling them you need to choose choices that are within your budget, that are reasonable and what you can afford to pay.
Right.
And then you try your best to work out a payment plan.
Right.
And that sounds like pretty good advice to me. Thanks,
It's
Judy,
it.
for
You're
being
welcome.
here. Again,
You're
this is
welcome.
Dan McCoy with DocDano.com, and thanks for joining us, and we'll be right back next time with more health information for you.